If you suspect hearing loss in one of your patient's ears, you can determine whether that loss is due to a sensory neural or inner ear problem or a conductive or external or middle ear problem using a Weber test. A Weber test involves a 512 Hertz tuning fork. What you'll do is strike the tuning forks which is vibrating, and then without disturbing the tines which are vibrating, you want to place the tuning fork at the vertex of your patient's head and see to which ear that sound lateralizes, meaning to which ear that patient can then hear the noise of the tuning fork. I say you only want to do this when you suspect your patient has hearing loss in one of their ears, because even if the person does not have hearing loss, the sound can still sometimes lateralize to one of their ears, even if both are healthy. So for this Weber test, let's assume that the patient has suspected hearing loss in the right ear. Thus, the right ear will be referred to as the bad ear, or the ear that has suspected hearing loss. So I will now carry out a Weber test. I strike the tuning fork, place it on the patient's vertex, and ask him, to which ear does the sound lateralize? The sound lateralizes to the patient's good ear, or to his left ear. This means that the patient suffers from sensory neural hearing loss and not conductive hearing loss. Had the sound lateralized to the other side, the patient's hearing loss in his right ear would be due to conductive hearing loss.